Good evening. I'm Denise Williams, President of NAACP, and here with me is Mr. Charles Patterson of Clark County Combined Health District. We're talking about the coronavirus. Post your questions in the comments section and we'll read them during the live stream. First, Charlie is going to give us an update on the status of the disease in Clark County. Charlie?
Well, thank you, Denise. I appreciate having me here today to talk about this very important topic in our community. The coronavirus is a nationwide and, in fact, a worldwide issue, which we're now calling a pandemic. Pandemic is basically a worldwide epidemic of a disease, and the coronavirus, which originated in China in December of 2019, has now reached our shores. The cases we have over 1,000 cases in the United States, and those numbers continue to climb. Over the last week and a half, we've seen a dramatic increase throughout the United States, and that's why we're seeing all of the things happen across the United States. Yesterday, Governor DeWine decided that we should close the schools starting after Monday's classes, and we're seeing a ripple effect across the nation where the NBA has postponed their games, Major League Baseball, the NHL games, the NCAA Final Four has been canceled or postponed at this point, and we're seeing that across our high school and college sports as well. Those closures, while they may seem like a fairly draconian measure at this point, are because we're really trying to stop the spread of this novel or new virus, which is sweeping across the world. The reason that it's moving so quickly is because it's a highly infectious disease, and in fact, it is a disease that we don't have any previous human resistance build up for. And so that's why we particularly are asking people to use all of the prevention methods that we're going to talk about later on this program.
Thank you, Charlie. We have a couple of basic questions that I would like to ask you, and we invite our online guests to send your questions in so they can be answered by Charlie Patterson. What is the novel coronavirus or COVID-19?
Well, COVID-19 is the nickname or the term we're talking about this new coronavirus that started in China in 2019. It is a virus that is now being spread human to human. We think that it came from bats, but it's recombined with a human pathogen virus, and therefore now it is easily spread between humans. COVID-19 will cause some illness in lots of people, but will cause potentially severe illness in some of our elderly or immunocompromised citizens.
What are the symptoms of COVID-19?
Well, the symptoms that we traditionally see with COVID-19 are a fever, a cough, and potentially shortness of breath. When I say those symptoms, you think, well, wait a minute, you could have that with the common influenza virus that we see around all the time. And in fact, we're seeing quite a bit of influenza virus right now and have over this winter and during the flu season. In fact, it's been a particularly bad flu season for us, and we've seen quite a few people hospitalized and many, many people sickened by influenza. That's one of the issues we're having right now is the differentiation between influenza and COVID-19. And so if someone is suspected to have the upper respiratory or even lower respiratory illness, we're going to first test for influenza and do a respiratory panel before they would be qualified to have a physician consider testing them for COVID-19.
Thank you. How soon do signs and symptoms develop after exposure?
So the typical time, once again, we're talking averages, and once again, we're talking about a very new virus. We've only known about this virus since December, so about 4 months here. So the scientists are collecting a lot of information every day on it. But we're thinking it's about 3 to 4 days before you see actual symptoms. And that's for individuals who are going to get symptoms. Some people will be without symptoms or asymptomatic. Typically, people become ill 3 to 4 days after exposure, and if they continue to get ill and start having the symptoms of pneumonia, we usually see them seeking hospitalization between 9 and 12 days after the initial exposure.
Thank you. If we could, let's move to testing and prevention. How does COVID-19 spread?
So the spread of the coronavirus is by respiratory droplet. When we say that, most of us have seen either a picture or a slowed down video of a sneeze, and you can see the many respiratory particles coming out, thousands of those little tiny droplets. And the way it's spread is basically someone coughs or sneezes, and then as that sneeze goes out or that cough respiratory particle goes out, then a little tiny particle with the virus in it goes in your nose or your mouth or gets around your eye, so any of your mucous membranes, and then it gets a foothold on the disease, or the disease gets a foothold in your body. Additionally, if you were to cough in your hand and then you were to touch a doorknob, or cough in your hand and then use a common utensil or pen, the next person that comes up uses the pen and then wipes their eye, or does something with their lips, and all of a sudden now you have this virus inside the body. So it can last on an inanimate object like a doorknob from anywhere from an hour up to 9 days. Once again, it's a new virus. We haven't done a lot of testing on it, but that's from previous coronaviruses that we know of. Once again, an hour to 9 days. So that's why it's so important to disinfect surfaces, especially common surfaces like a doorknob or a pen or something. In fact, we're right now recommending that we don't use common pens like on a chain at a counter, that we just put a fresh pen up there and let people take those away so that they're not sharing pens.
Got it. Next question is, should we wear face masks to protect us from the COVID-19?
So the Surgeon General has come out, the U.S. Surgeon General has come out and said that typically for the average person, wearing a face mask is not the proper thing to do. There's a couple reasons for that. Number one, they're in short supply, so we need to keep them available for those individuals that need to wear them. Secondly, we put them on a sick person, because remember we just talked about that cough or that sneeze and those respiratory droplets coming out. Well, if we put a mask on a sick person and they cough or sneeze, it's going to keep those respiratory particles, those droplets, in the mask, and very few of them are going to get out going towards another person. Now, with a regular surgical mask, there may be some that go up or to the sides or down out of that mask, but they won't be projectile out towards the person that they're speaking with or that they're closely associated with. We also think that clinical providers who are working with a sick patient should be wearing them as well. One of the reasons why we wouldn't want just the common individual on the street who's not a provider and who's not sick to wear the face mask is also because when you wear a face mask and you're not used to it, number one, you may not wear it properly so that it provides the best protection. And number two, since you're not used to wearing it, people tend to go to their face a lot and adjust it. And some research is showing that it potentially increases the chance of spreading a virus or bacteria because you're touching your face a lot more. And that's one of the prevention methods that we're requesting people to do, is be careful in putting their hands up around their face because of your eyes, your nose, and your mouth where you have those mucous membranes.
Got it.
The last issue is that if we're wearing, masks are in a short supply. So people tend to wear a mask longer than recommended, which means now they have a warm, moist environment around their face which is actually increasing the chances that other things like pneumonia could potentially be causing a problem.
Okay, thank you. Is COVID-19 testing available at Clark County Combined Health District?
So while the health district does not perform those tests really need to come, they have to be ordered by a medical provider, and they're currently available through the medical provider and through Springfield Regional Medical Center. Now, you can't just walk in the door and get a test. There are a lot of things that have to happen. Tests are in short supply across the country, but very shortly they will be, more and more will become available. Mm-hmm. So right now, the tests that we have available are reserved for those individuals that are at high risk, those people that are hospitalized and have the symptoms of COVID-19, and those individuals who have symptoms and have either travel or close contact with a known positive case for COVID-19. And so if someone thinks that they have it, the first thing to do would be to call their primary care physician, call their provider, and begin to have a discussion with them about what to do next. Before anyone is tested for COVID-19, they're required to have an influenza test first, because that would be a good rule out. A lot of the folks that have been assessed by their providers in Clark County, they're first having a flu test and that's coming up positive. And so we know that's why they have the fever and the cough and the upper respiratory symptoms. It's because they have the influenza, either A or B. Mm-hmm. And we know there's a lot of that around. Right. The second thing is, if that flu test comes back negative, then we're going to ask them to have a respiratory panel done, which is another lab test. Mm-hmm. And then most of the folks we're seeing are also coming back positive for either rhinovirus or some other virus or bacterium that's causing the problem for them. And so if they're negative to both of those and they meet all the other criteria, then the physician would consider screening them for a lab test for coronavirus.
Okay. I've been feeling sick for a few days. Can I go to work?
Well, we would ask people to use the same guidelines that we always use for whether you go to work. Mm-hmm. I mean, do you have a cold? Then you should probably go to work, but you should also stay away from people, mm-hmm. and you shouldn't cough on them. If you have a fever and you have a cough and or shortness of breath, then you need to stay home. Mm-hmm. Anytime people have a fever, we tell them to stay home. Okay. So that is a good guideline. Fever free for 24 hours before you go back to work. Mm-hmm. Now, if someone were to get COVID-19 and they were tested positive, then we don't use that rule anymore. Mm-hmm. Fever free after 24 hours, because you can shed this virus for weeks after you stop having a fever. Okay. But so your standard criteria that you would use, when would you go see a doctor for that, because you haven't been feeling well? Mm-hmm. Well, whenever you would normally go see a doctor, that's when you should go see a doctor now. If you feel like you have the COVID-19 symptoms, you should, especially if you have contact with someone who is a positive COVID-19 case, or if you have the international travel, or you've traveled to a region in the United States that has an outbreak going on currently, then those folks should call their provider before they go in to make sure they're not potentially exposing other people to this devastating virus.
Thank you. We have a few questions from our cyber audience, if you will. This is from Melissa. She has two questions, as a matter of fact. One is, how many people are being tested in Clark County?
Well, we do not disclose how many people are being tested in Clark County. We don't disclose the number of persons under investigation in any of the counties throughout Ohio. The state will declare how many people they're under investigation across the state, but we don't separate them by individual county. I can tell you that our staff have been working every single day working with medical providers, going through the checklist and the screening, working very hard to make sure that the tests are used on the correct people, and if the people screen out, that we're not using these tests on them. So we can't do really, I can't comment any further on that specifically for Clark County because the rules the state has laid out for us.
Okay, thank you. Another question from Melissa. She is asking, should people be stocking up on food and paper products?
Well, I think we're seeing a little bit of a panic situation at this point. And one of the things that we're telling people is this is not a time to panic. We don't see any issues with the food supply. The grocery stores are getting their regular food chain as they normally have. It certainly always makes sense for families to have a 2-week to 30-day supply, but we say that all the time. This has nothing to do with coronavirus. It has everything to do with being prepared. So if you go to the website ready.gov, that's a government website where it has a lot of information on what supplies you should have in case there's a tornado. You know, we're coming up on tornado season right now. In case there's another kind of natural disaster, you know, we're just coming out of winter. We could have had a snowstorm or an ice storm that shut things down for several days. So it's always a recommendation that people have a small stockpile of food and products and fresh water to drink to make sure. But we're not recommending anything different than what ready.gov has on the website for this particular virus. The concerns we're seeing now is people seem to be excessive buying when it comes to products where we'd be better off right now to just have what we need, just have enough hand sanitizer for ourselves. We don't need to have multiple cases at home. I don't have multiple cases of sanitizer, hand sanitizer at home. So I didn't stock up on that. I have 1 or 2 bottles, which I normally have for my family. And the hope is that the supplies will come back and people will be more normalized in their buying habits than they are right now.
Okay. Thank you, Melissa.
That's a great question.
That was a great question, Melissa. Another question we have is from Vicky. She asked, will the CCHD be posting information on the number of PUIs that are in Clark County? First part of her question. The second part is the number of individuals listed as under health supervision.
Okay, and so once again, that's similar to a question we had before. We won't be posting on our website the work that our staff is doing every day, and we're doing that really because we need to be very careful and confidential about the individuals that we're dealing with. We have a system set up where our first responders are being protected, and if we get a positive coronavirus case, we will make that public. We will let the appropriate individuals know. We'll be doing contact investigations to make sure that folks are quickly notified if they have to be in quarantine or if they need to do self-monitoring. And so we have a pretty good system set up here. And there's no doubt, Denise, that, you know, whether it's in the next week or in the next month, you know, we will see positive cases of coronavirus in Clark County. But the thing we're trying to do with all of this prevention work and all the schools closing and all the gatherings being shut down, what we're trying to do is we're trying to take that very steep pandemic curve that we saw in China and we're trying to flatten it out. I'm not sure if you saw, but the Chinese government came in and they built several hospitals in just a very short period of time.
Right.
I'm not sure that in the United States that we're equipped necessarily to do that. We have buildings that we could use if we needed to house additional patients, but what we're trying to do is take that steep curve and flatten it out. Imagine that you have a balloon that's this big, and if you put your hand on top of that balloon and you push it down, what happens to the balloon? It doesn't just, the volume of the balloon doesn't go away, but you flatten it and it goes out. And so the chief concern right now is that we don't overwhelm our medical system and that we don't overwhelm our supply chains.
Mm-hmm.
And so by pushing the pandemic curve down, instead of what we saw in China, to push it down, and it's going to take longer to resolve, more months, and we're not talking about days, we're talking about longer months for it to resolve, but then the hospitals will have enough room and enough patient rooms to treat each of these patients instead of all of them being stacked up at one time when we can't get to them. So in addition to that, there's some problems getting respirators and proper personal protective gear for our medics and our first responders and our hospital. So if we stretch this out, it gives us time to backfill and get more product, get more of the N95 masks, get more gloves, get more gowns and face shields, all of the items that we need to protect our critical health workers who they're going to be treating people with COVID-19. We can't have them get it because they don't have the right equipment. So it's really important for us to understand that the government's not trying to be mean and cancel the schools, and they're not trying to be mean and people are going to lose money because the businesses won't be doing. This is a measure where we're truly trying to save lives. And so, our doctors, our nurses, and our EMTs, they save lives every single day. And this is an opportunity for people like you and me who aren't those everyday heroes. We have an opportunity right now to become heroes. We have heroes to our extended families and to our friends and our coworkers because we're washing our hands, we're staying home when we're sick, we're keeping our relatives away from sick people, we're checking on our older adults, but we're not spreading the virus to them. We're making sure that they have food, that they don't have to go to the grocery and put themselves in harm's way.
Absolutely.
It gives us the chance to be a hero and to literally save somebody's life. And that's going to be a life that we can save in the next couple of months. I know people are going to be antsy in their houses.
Absolutely.
They're going to be like, wait a minute, I want to travel and I want to go back to all this stuff that I was doing. You know what? We'll get there. But let's get there together. So that we're all alive and we can all enjoy the future together.
Absolutely. That was a very good question, Vicki. Let's go to Pat's question.
Okay. There
are no tests, so how do you know there are no cases? Good question, Pat.
Well, it's a good question, but I would have to say there are tests available. The CDC's been testing all along, and so if we had somebody who met the initial qualifications, those folks were tested. And the state health department lab came online last week, and commercial labs have been coming on from last Friday until today. And so I know there was a large announcement this afternoon from our Vice President Pence about the coming availability of tests. So we're going to get more and more tests. The tests we're doing right now are to the highest risk people and the people who are most likely to have it. But there is a time soon when more and more people are going to be able to get those tests. And the other thing we have to understand is the more tests are out there, then we're definitely going to find more cases because we know it's being community spread. We know it's been seeded across the United States from travelers over the last couple of weeks or months, and that it's definitely here and we're going to need to deal with it.
Yes. Good answer. Good. This question is from Amy R. She asked, could you have both the flu and COVID-19?
An excellent question, and it's a question that we're researching right now. Unfortunately, Amy, we don't have an answer for you at this time. There is no literature anywhere. I've personally searched for it in the medical journals, looking for that co-infection between influenza and COVID-19. Experts have surmised that it's very unlikely to have because the viruses would be competing and one of those viruses typically wins out. But I would tell you that the jury is still out on that. It's an excellent question, and unfortunately we don't have the answer. It is very unlikely that you could have both But is there a potential? Certainly, there's always a potential.
Okay. So, Mr. Patterson, I have a question regarding the children. Now that the schools are closed, some children in some communities rely on breakfast and lunch. So, how is Springfield handling that?
Well, I would tell you, I've had a recent discussion with Dr. Bob Hill from the Springfield City School District. And Dr. Hill assured me that this was several days ago, that they already were making plans on how to provide bagged lunches for distribution at the schools, at their neighborhood schools, during this time when they're closed. Folks, this is something that we've been talking about, because we didn't know the governor was going to close the schools next week.
Right.
And so we've been looking at, how this is going to happen and what would happen if some of the schools had to close. And so this is a plan that the Springfield City Schools has in place. They have a waiver from USDA to be able to distribute those lunches even when they're not in school. Mm-hmm. And they have a plan on how to do it without having a mass gathering. Okay. So folks aren't going to eat it there. Yeah. They're gonna take the food and go. Mm-hmm. And so we're proud of our city schools for working that out. Yes. And we also know that our local food bank, the Second Harvest Food Bank, mm-hmm. Tyra Jackson has really, she's been working very hard to make sure that they can extend that even to other schools that need. They've reached out to every school in the county to see what kids might be in need and how the Second Harvest Food Bank could help provide some additional food for those families. So that's a great question, and one that is being addressed even this week. Okay. From our superintendents and our local food bank. Okay. And I would just add that if people want to donate to that effort, mm-hmm. Donate to the food bank, they certainly can easily just Google Second Harvest Food Bank in Springfield, Ohio. And while food donations are accepted, monetary donations really make the difference, because they can stretch that dollar. Okay. If you spend $1 at the grocery store and donate that food, they can take that dollar and they can stretch it a lot further than you're able to, because remember, they're going to buy that food wholesale, mm-hmm. and even maybe at a further discount. Yes. And so they can provide an awful lot of food for a very little amount of money. So if people want to help that effort, reaching out to Second Harvest Food Bank would be the way to do that. Okay. Thank you so much, Mr. Patterson. Is there anything else you would like to add? Well, I'd just like to say that this is an unprecedented time. Yes. In our history. I mean, if we think back to the 1918 flu, that may be the last time we had a significant worldwide pandemic. And I would tell you that the worst is yet to come in this. We are going to see cases, yeah. And unfortunately, we are going to see more deaths across Ohio and across the nation. But this is a time when we can all pull together. Yes. And if we all do everything we can do, we are going to lessen the number of people who lose their lives in this, mm-hmm. and we can make a difference, each one of us, in the outcome of this pandemic. Thank you so much, Charlie, for answering our questions. Thank you to our Facebook family out there. For more information, you can go to the Clark County Combined Health District website at ccchd.com. Thank all of you for participating in our online questions. We will be back if necessary. So the NAAC wants to say thank you so much. And remember, let's all pray together for ourselves, for our family, and for our community. Thank you so much, Charlie, for being here. We really appreciate it. Thank you.